Hi all. Today, as the Testicular Cancer Awareness Month is going on, so we have with us Dr. Tarun Jindal, head of Uro-Oncology of Narayana Superspeciality Hospital, Howrah. So, regarding this Testicular Cancer Month, we're going to ask you, Dr. Jindal, can you tell us what exactly is the testicular cancer all about? How common is it?
So testicular cancer is not a very common cancer. It usually affects 1 male out of 300. The commonest age of presentation is around 20 to 40 years, or it can rarely be seen in patients around 60 years of age. The tumor is not very common, but it's one of the good tumors, and the treatment, if done properly, the results can be very gratifying for this tumor.
So, Dr. Jindal, can you elaborate upon the causes of testicular cancers?
So there are no specific reasons why testicular cancer occurs, but it has been found that people come to us with history of trauma to the testis, which led them to find that there was the testicular enlargement. Though trauma is not directly related to causing testicular cancer, but it is an inciting factor which makes people recognize that there is some abnormality in the testis. There are certain very observant people who notice some lumps or bumps or increment in the size of their testis. Apart from that, this is generally a very silent tumor and doesn't have much symptoms. So that's why we recommend that males should examine their testis. That's called the self-testicular examination, by which they should notice if there's any abnormality in either of the testes as compared to the other one, or there's a size discrepancy, or they are able to notice some kind of enlargement, humps or bumps in their testis.
So, as you said that there are no particular symptoms per se, then what can you just throw light upon the management of the testicular cancer part?
So, management of the testicular cancer depends upon the stage which we are dealing with. So testicular cancer can be restricted only to the testis, or it might be going to the cord. Cord is the structure by which the testis receives its nourishment. So it contains the testicular artery, the testicular veins, as well as the vas deferens. So if it has spread to that part, or if it has spread to the intra-abdominal area, so it has gone to the retroperitoneum. So the management depends upon the stage which we are dealing with. It also depends upon the specific chemical biomarkers which we use for testicular cancer. So their level also helps us to determine the management. So if it is restricted only to the testis, we usually do an orchidectomy, which includes the removal of the testis along with the cord completely, and we send it for biopsy, which tells us the local staging. We do a CT scan, which tells us the systemic staging, and if there are certain nodes present in the abdomen or in the retroperitoneal area, we give these patients chemotherapy, by which we shrink or completely dissolve the tumor which is present inside the abdomen. The role of surgery also comes again if there is a residual mass after giving chemotherapy in the retroperitoneum, and the clinician feels that there is a chances of a viable tumor being there or a teratoma being there. In that part, we excise those viable tumors or teratomas by doing surgery.
Okay. So, Dr. Jindal, are there any screening modalities available through which we can, suspect that this person might be having testicular cancer or carrying the risk of developing it in the future?
Right. So we cannot predict that this person is going to develop a testicular cancer, because as I've already told that there are no predisposing factors which lead to this particular cancer. But self-testicular examination, that is the major thrust of testicular cancer awareness month, that males should be aware that there is an entity of testicular cancer which manifests as testicular enlargement or irregularity of testis, or the testis becoming hard. So it is mandatory that males should often check their testis, and the best comparator is the other testis. So you should compare one testis with the other. If they both appear similar, then you're okay. If you notice an enlargement of one testis, then you should consult your doctor. If you notice that the testis is becoming harder than the other testis, again you should consult a doctor. I'm not saying that hardness is absolute indicator that the person would be having cancer, but yes, this should be the inciting factor for a patient to seek medical assistance.
Okay. So thank you so much, Dr. Jindal. That was quite an informative talk about the testicular cancers. And at this note, I would like to say that do reach to your urologist if you ever feel any lumps or bumps in your testes, because our urologists are there to provide their specialized care to you. Thank you.